Hi, I'm David Silverstein, and I've created Brokenhealthcare.org because the American healthcare system is in big trouble and nothing is being done about it. Legislators at both the state and federal level are failing us, and in many cases, they don't truly understand the depth of the problems they've created and are making worse with piecemeal legislation. Now, don't get me wrong. We have the best care in the world in the United States. I would not want to be sick or injured anywhere else in the world. But the payment side of our system is so broken that the future of care is at grave risk. We are all customers of the American healthcare system. This problem affects us all, and it's up to us to change it. The principal problem lies in the hospitals, which are the least competitive element of our system. I've created Brokenhealthcare.org to advocate for patients, and I've created it to literally deny payment to hospitals, and in some cases, the physicians that practice in them, one patient at a time. Patients are paying more and more out of pocket. Higher copays, high deductible plans, health savings accounts, they all demand that we receive information that we need. And I say the information we are entitled to. The way we pay for healthcare today is among the very worst systems in the world. And I'm not advocating for a single-payer system. I'm advocating for a competitive system, one that allows patients to be responsible consumers. Let me give you some examples of what's going on every day. When hospitals fail to provide transparency by publishing their real prices, by explaining the basis of their prices, by providing the same level of detail you'd get if your car were being repaired, by disclosing the nature of the agreements they've made with your insurance company, you can't behave as the responsible healthcare consumer that our system is pushing you to be. Jamie is one of Broken Healthcare's clients. She's in her mid-30s, she's uninsured, and she's always been healthy. She has no kids. So ask yourself, how would Jamie know the ins and outs of how the healthcare system works, and especially the payment system, when she so rarely had to use it? Well, Jamie went to a local hospital earlier this year and was diagnosed with pneumonia. Her bill, $16,000. But because she's uninsured, it was reduced to $8,000. When I first talked to Jamie, I asked if it would be helpful if I could get her bill down to $4,000. And her answer, oh my God, yes, that would be so amazing. But it's not. Because if she was being billed under my insurance company and its negotiated rate, her bill would have been about $2,500. So what do we do about this? What we're doing is we are denying payment completely. We're sending a message. And in this case, Jamie saves $8,000 in the process. Here's another example. I received a letter after asking questions following one of my daughter's many visits to an emergency room. The letter read, regarding your request for the hospital's prices, that is not information our hospital publishes because it's not required by law, and for a system our size, there are anti-competitive and other reasons we cannot publish our prices. Seriously? Brokenhealthcare.org is helping people dispute their bills and demand the information we're entitled to. And ask yourself, what judge or jury is ever going to order you to pay a bill that is not sufficiently explained? That's all we want. Prices, the basis of the prices, the negotiated basis, and a breakdown of what we're actually paying for in a way that we can understand it. Thus far, every single bill we've disputed has resulted in zero payment and zero damage to anyone's personal credit. With your help, we can do more. We can help more people, and when a broken healthcare patient finally gets taken to court, we will provide for their legal defense. But don't expect it to happen because the hospitals have no case. I received another letter from a hospital. It reads, publishing lists of hospital charges generally is not helpful to the average consumer in making price-based decisions. And here's one more example. Last year, one of my daughters went to the ER at 8 o'clock in the evening. She dislocated a finger, the coach couldn't pop it back in, and urgent care was closed. So it's off to the ER. As is the case many times, in addition to the hospital's ER bill, we also received a bill from the physician's practice. It was for $700. Only after we sent 3 letters demanding copies of the price list for the physician's practice did they write to me and say they had mistakenly charged us for a fractured finger, not a dislocated finger. So they adjusted the bill to be several $100s cheaper. The same letter went on to say, but we won't give you our price list. So I ask you, how would I have ever known there's a different charge, a different code for a dislocated finger versus a broken finger? How would I know that without the price list? I still refused to pay the bill. Instead, I asked, how would I now know if there's a different charge for a broken pinky versus a broken thumb? And the answer is, I can't. Until we have the real price lists, we don't have the information we need to validate our bills or to shop responsibly. We're denying payment legally by exercising our rights, and we need to spread the word. We need thousands and millions of Americans to say no more. No more surprise bills. No more hidden agreements between hospitals and insurance companies. No more secret price lists. We need your help to raise the money to build out the brokenhealthcare.org website. We've established a 501c3 nonprofit organization. We need to hire staff to produce tools and templates, to provide assistance to people writing dispute letters, and to empower people to demand their rights. This is America, and this is how it works. This is how we get it done. Everyone knows someone who's faced a ridiculous and mysterious medical bill. Help us put an end to it, and help us save our healthcare system from itself. Thank you.